Over 10% of the Indian population is affected by chronic kidney diseases, while over 2.5 lakh patients suffer from renal failure every year. And while dialysis in India costs roughly $25 per session, as compared to $300 globally, affordability and accessibility related challenges continue to loom large. Renalyx Health Systems is on a mission to advance renal care by developing dialysis machines that are 30 to 40% cheaper than the competition and equipped with remote monitoring capabilities. So to shed more light on the subject and the solutions, we're joined by the founder and director of Renalyx, Dr. Shyam Vasudev Rao. Sir, thank you so much for taking the time to join us.
Thank you. Same here.
With that, welcome to our special feature, Renalyx presents Innovate India, mission to redefine kidney care, partnered by ET Now. And for the benefit of our viewers, sir, as I mentioned in my introduction, over 2.5 lakh patients in this country suffer annually from renal failure, from kidney failure, right? Where do the biggest bottlenecks lie in your view?
This is a very big problem, which is the accessibility to this renal care, which is only in the bigger cities and towns.
Sure.
And also there are a lot of people in the rural area who are at a much higher risk of getting this chronic kidney disease, and for them it's a double taxation there because they have to come all the way to the bigger towns and cities for this treatment, and every alternate day they have to be there. It's a huge burden.
Absolutely.
And how do we get this access is one nice angle, and the other one is the affordability, which is basically it's an expensive treatment. And on an average, a person would need to spend at least 25,000 rupees a month just for the dialysis. And this is also, needs a lot of supplements and nutraceuticals, because they lose a lot of proteins when the dialysis is happening.
Absolutely.
So it's a huge burden on the family, and the governments are now seeing this seriously, and we are also working on how we can increase access and also make the treatment affordable.
Well, thank you for setting that context, sir. By way of a follow-up question, tell me about the Renalyx Make in India dialysis machine. How is it different essentially from other models available in the marketplace, both domestically and abroad?
Yeah, Renalyx, as the name says, renal extension. We believe in not just doing the dialysis treatment, but also, looking at how we can prevent people getting into the stage.
Right.
So we are having product where we are trying to see how we can screen these people and at a very low cost, and most of the time it can be a self test, and with that we create a medical record for them, and also we have a very smart algorithms which is embedded into the mobile apps, which can help them to manage the disease in the early stage. And for those who are actually going through the renal failure, kidney failure, and need dialysis, we have a smart connected dialysis machine. That's where we are very unique in our offering, and that's how we want to see how we can, instead of the patient go to the hospital, can the hospital go to the patient.
So it enables remote monitoring.
Exactly.
How
remote
so?
monitoring.
How so? What is the underlying technology powering that remote monitoring? And sir, by way of a follow-up, you also mentioned cost a moment ago. So my understanding is that the Renalyx dialysis machine costs roughly 30 to 40% less than the competition. So how do you empower that cost savings as well?
So there are two types of costs here. One is the direct cost, which is for the patient when they go for dialysis, what they have to pay for, and there is the indirect cost, which is actually much more for the people who are coming from outside, particularly from tier 2, tier 3 or rural area.
Right.
And what dialysis, our machine offers is flexibility because of its connectivity and its smart features built into it. We can put these machines in the rural area, and the doctor can manage it remotely. The doctor's intervention is only needed when there is an emergency. And otherwise, normally the dialysis centers are managed by the dialysis technicians. So, that is how we are trying to see how we can bring this cost down, particularly the indirect costs, and also on the machine, we have the cost of ownership which will come down by 30 to 40%.
And
so
do you anticipate, sir, that this cost savings and this groundbreaking transformative approach can help bridge the urban-rural divide that exists in this country when it comes to renal care?
Certainly, because the direct costs are now getting reimbursed, and the biggest burden is the indirect cost. And if I am going to help the people by bringing this dialysis service closer to their doorstep, then that is going to be a huge saving for the people, and lot more people would go for dialysis and survive, live for more time.
Very heartening to hear that, sir. And in this country, dialysis is largely an out-of-pocket expense. So are there plans in the pipeline perhaps in terms of partnering with insurance providers, or the invention, or rather the introduction of new government schemes and policies that may change that?
Certainly, that is the idea why we have the prevention part. And I am sure the insurance people would be happy to embrace this, because you can now prevent the disease progression, catch those who have the problem at a much early stage, so that the cost of managing this will be lesser, both for the insurance company as well as for the patients.
Sure.
And then for the ones who are going through dialysis, the insurance companies can also be a very good partner, because they know exactly how many dialysis is done, how the patient compliance is.
Right.
And we also are coming up with the concept of personalized medicine, so that we don't have to do dialysis for 3.5 hours for everybody.
I see.
So we have a patented technology by which we can dialyze the patient. Once we learn the patient's metabolism, their food habits and all that, we can see that they may need lesser period, and we can also advise them how to keep the compliance, so that they can reduce the time. So this is all very useful for the insurance companies.
Oh, very heartening to hear. And sir, my understanding is that Renalyx is a champion for the Make in India movement. So tell us more about the initiatives tied to this movement that have helped accelerate your development plans, your manufacturing plans, and ultimately the commercialization of what you offer.
Certainly, this is a really truly Make in India, made in India, I would say, not just Make in India.
Right.
It's a made in India concept, totally developed right from the grounds up. We have done the entire innovation, and we have patented technologies for this. We have 5 patents and all international patents, and the government has been very supportive of this. We have had the grants from the government, Department of Science and Technology, and we have also soft loans from government to initially take care of the development, and we have been recognized very well by terms of awards and all that. So government has, DST has this Lockheed Martin gold medal, so we are one of the gold medalists from the
Congratulations.
program.
No small feat. Yes.
And the government is now having a lot of schemes also to reimburse the patients who are going through dialysis, and this is part of the PM National Dialysis Program, PMNDP, and under that scheme, those who are going to these government centers, the dialysis is the direct costs are all taken care of, and also they are eligible to the ESI employees. They are also very much, they give the reimbursement for these patients. Even in private centers they can get dialysis done. And thirdly, the Ayushman Bharat, that is also now reimbursing these dialysis programs. So that way there is a lot of push for making dialysis more affordable.
Now, sir, you've walked us through the USP of Renalyx vis-a-vis the Indian market. If you could do the same vis-a-vis, our global counterparts abroad, how does it compare?
Definitely, see, there is a huge population which is underserved,
right,
globally as well. we see that Africa is a big market where they are at a much higher risk of chronic kidney disease because of various reasons like the pollution, the ground pollution, water pollution, all these things.
Right.
So, we see that the concept what we are using, which is our USP, that is early detection, disease management,
Yes.
connectivity, telenephrology, remote monitoring,
Right.
all these things can be is what is also applicable to them. And we are working with couple of countries now to see how we can launch our program there and see that it is not just for India, it is from India and for India and then from India. Yeah,
Made
that
in
is what we
India,
want
but
to do.
perhaps made
For
for
the rest
world.
of the world, yes.
Right. Well, sir, bringing the conversation a bit closer to home, tell us about the Renalyx's partnership with, Bharat Electronics and how that has aided you in your ambitions across multiple parameters again, be it commercialization, development and manufacturing.
Yeah, during the COVID time, Bharat Electronics was jumped in and they wanted they had to make a few ventilators and oxygen concentrators and all that which was needed for the country at that point.
Right.
And soon they realized that this is going to be only for this emergency for COVID. But then what do we do next? And there was no better product for them than our dialysis machines. So that is when we are approached and we partnered with BEL as a technology partner, and we have a co-development or we had made a partnership as a co-development partner for Bharat Electronics. That's a very prestigious thing for us.
Absolutely.
And BEL has licensed our product, one of the product which is RXT17 we say, that's the first version, that has been licensed by Bharat Electronics and they get to manufacture and sell that product for a period of some 5 years, something like that. So that way, it's a very, very good partnership to start with.
Sure.
Not just limited to that, we are also a collaborative R&D partner to BEL for medical devices. So we have initiated a couple of new ideas and we are working with them on developing those products.
Well, sir, since you brought up what next, what's next for Renalyx as a brand? Are there perhaps other related health issues that you're currently eyeing, or what innovations are currently in the pipeline that you can tell us more about?
See, dialysis is, normally people think it's only for people with kidney failure. But it's not the case. Dialysis is a process of purifying the blood.
All right.
So this can be used in several different ways.
Sure.
And we are building these extracorporeal systems, we say. And these extracorporeal systems can be used for heart-lung machine. We call it as ECMO, extracorporeal membrane oxygenators.
Okay.
So that's one of the things. We are using it also for blood transfusion.
Sure.
We are using it for a liver assist device. We have developed with another partner.
Phenomenal.
A concept of liver assisted device, and that's now going through clinical validation. So there are several other things what can be done with the architecture and the technology what we have.
Sky's the limit.
So we are working on those things. Yeah.
All right. Dr. Rao, by way of a personal question, you of course have a long-standing background in high-performance computing. So what inspired you to build a career around renal care?
As an engineer, we have also a responsibility to see that if there is something which is needed and if we can do it, why not we do that?
Right.
So I had very comfortable job in multinational companies like Ericsson and Philips and all that. But then we were not in a position to make big impact as an individual. And more, whatever we developed was for the Western world and for those markets where there is a lot of money.
Right.
So I wanted to do something for us, for our community and our country. And the thing what we see is in healthcare, it is the non-communicable diseases which are a big burden.
Right.
NCDs as we say,
Right.
hypertension, diabetes, COPD. These are some of the things, which are big. And
Sure.
among them, diabetes is the
king.
leader, I would say.
Right.
And then, of course, hypertension. So, the comorbidity of this disease, which is the eye problem, which we call diabetic retinopathy, and then the kidney problem, which is diabetic nephropathy, and the vascular problem, which is diabetic neuropathy. These are the ones, which is a big burden. And most of the time when a person gets this, it's irreversible. And they normally don't get to know that they have the problem until it has gone to the end stage.
Unfortunately.
Yeah.
Yes.
So that is where, I was very much motivated or interested in seeing how we can reduce this burden
Sure.
to the society and to the country, and also, make an impact in the society.
Very inspiring to hear that. And what are your expansion plans for Renalyx going forward, both within the country and well beyond?
What we are doing today in Renalyx is the early detection, disease management and dialysis, and the dialysis is done in institutions like in hospitals or PHCs or nursing homes. What we want to do is we want to bring this dialysis to the bedside of the patient.
Right.
That is very important because a lot of them can't get out of the bed. They are obese or they have problems, particularly the geriatric population.
Sure.
So, what we see is that how can we bring this dialysis to their bedside,
Right.
so that the dialysis can be done at their comfort at home.
Phenomenal.
And that is going to be our next product, and that is going to make dialysis, it changed the paradigm of dialysis totally. And even those who are going to the institute, the hospitals, will start using this, and they are getting this dialysis at their convenience.
So we very much look forward to that, and we salute all of your efforts. And by way of closing comments, sir, any parting words of wisdom to viewers who may be tuning in, or entrepreneurs perhaps that are still struggling to find their footing in this space? How might you guide them?
I feel that there is a lot of opportunities. There are a lot of societal problems around us. And obviously, they also have a lot of money is there in this. So, I would say that, we need to do a sort of design thinking.
Right.
And immerse ourselves into these sort of things, into these problems, try to observe. We spent a lot of time, in dialysis centers. Almost 2.5 years I spent in dialysis centers with my friends, who are nephrologists, to understand this problem.
Sure.
And once you get the problem right, I would say it is half the problem is solved.
Sure.
And then we can make a big impact.
So great
is-
advice. Yes.
Yeah.
Well, we thank you so much for joining us, Dr. Rao. We salute everything that you do, as I mentioned a moment ago, and we wish you and the Renalyx team all the continued success. With that, our special feature, Renalyx presents Innovate India, mission to redefine kidney care, partnered by ET Now, comes to a close. We trust you found the insights shared of value. Thanks for tuning in.